Does it make sense to say, like, you have to pay your no-show fee before the next session? Or I guess, yeah, how would somebody think about navigating that?
Yeah, and we've had at different stages of larger clinics I've been at, that has actually been a clinic-wide policy that if you haven't made a payment towards your no-show fee or worked out a payment structure, we will not schedule your next session. When it gets to that point, it's important to let the provider know that, hey, your patient can't schedule till they pay, and maybe you can reach out to them as well. And, having the ability to take partial payments so people can continue their care, I think is important also. It is out there in the clinical world that, well, you can't abandon your patients, so you have to keep seeing them if they don't pay. No, that's not really true. You're a service provider and you don't just work for free, and definitely easy to pause therapy. If you're working with a very sick patient that needs medicines and is at risk for harm, is an obligation maybe to be there to hand off care and figure out some other solution. But you don't need to keep providing free care to people who haven't been paying their bill. That's just, if people have concerns about that and the legality of that, everyone can always check with the lawyers at their malpractice insurance. But there is nothing written that says no matter what, you have to keep providing care to a patient that hasn't paid your fees. We would often offer, if you can reschedule within the same week, that then we would waive the no-show or cancellation fee. Providers don't want their patients to get hit with a no-show fee. And often you've got some other open blocks from some other patient that was on vacation, or, maybe you're willing to give up half of your lunch hour to squeeze a patient in to see them and generate that revenue. So that can be a very effective strategy, as well as is allowing, if you can reschedule and get in the same week, that will waive the no-show fee.
For cancellation policies, does it make sense to say 24 hours, 48 hours? What have you found to be the most effective?
The nicer thing about 48 hours is that does give you time to potentially bring in a brand new patient to your practice.
Right.
If someone, it gives time for someone to complete registration and office policies and put a new patient in there. 24 hours, if you have even if you have a long waiting list, reaching out to someone, sometimes it's hard for them to respond right away or grab that 24-hour spot. Busy practices, often you may have another list of patients who need an extra appointment, that those can sometimes establish patients you can fit if you have a 24-hour notice. So it all sort of depends on the size of your clinic. Are you solo practice? Do you have other clinicians working for you? 72 hours just feels a little bit far out for the cancellation policy and isn't good for your business.
I would agree.
Yeah. I think the smaller your business is, the shorter your cancellation policy should be.